I'm here today with Dr. John Patrick. John Patrick is a friend of mine. He's also on my board at OCLC, and he's written a new book called Health Attitude. And your career is so interesting because you are a technology pioneer, you're a technology innovator, and you also been on the board of a hospital, and you now have a doctorate in healthcare administration. So you have this kind of dual world, I guess. I'm thinking technology and also in healthcare. And so I thought I'd just start off with that because the intersection of those two things is so interesting. What is happening today in the world of innovation in technology that relates to healthcare? What kind of new inventions are kind of popping out there in the consumer world?
Well, that's a good question. I would say that everything that's happening in the world of technology is relevant to healthcare. The problem is healthcare is not taking that in, adopting it as rapidly as other industries. And that's one of the reasons why healthcare is so expensive in America.
Healthcare costs keep going up and up and up. But we as consumers are using all of this, new apps and new, Fitbits, and you've talked about
Apple Watch.
Apple Watch. What will Apple Watch do? I haven't even read about what it will do for us in terms of healthcare.
It's going to be great. It's going to basically be your health monitor. And initially it's just like a Fitbit, counting your steps. But later it's measuring your heartbeat, and it's looking for arrhythmia. And it provides a way for you to tap it and tell it how you feel. And combined with the Apple Research Kit, it's going to open up research panels and paths that just haven't been possible before, where millions of people that have asthma, for example, when they get an attack, they can tap the watch, it'll capture the latitude and longitude, and it will allow big data and analytics to become real time so that other people that are asthma sufferers know, don't go there.
Amazing, but that today is not connected at all into our healthcare administration system.
No.
And that's part of the issue.
That's part of the issue.
So we're not using the new innovations in technology that we could be.
That we could be, not to the degree that we could be.
So
there's a lot of innovation going on in healthcare in the advanced research centers, and there are a lot of innovative hospitals out there, but looking at the system as a whole, way behind.
It's like we're not connecting the two worlds. We have all these advancing, more and more imaging and things in the world, but those two things are like completely divided, if you will.
Yeah, exactly right. The lingua franca of healthcare is the fax machine.
Amazing.
What other industry do you walk into and they greet you with a clipboard? And then they say, go to this other department, and you go there and you get another clipboard to give the same information that you just gave.
It's sadly true.
And in both cases, it's information that they already have.
And they don't actually verify if there's a mistake on one or the other. I want to talk about one of my favorite quotes of yours, and it runs all around the internet. Whenever I send it out, people retweet it everywhere. And it's something that you used at IBM running Skunkworks. And it is, think big, act bold, start simple, and iterate fast. How does a mantra like that work with healthcare and the healthcare system? What would we do differently if healthcare administrators kind of adopted that philosophy?
Well, perhaps the best way to approach that question is to think of the anti-version of that, which was healthcare.gov. Think big, start big, act big, fail big. There were no baby steps.
Interesting.
No incremental aspect to it. It was just one big, huge launch. And in the world of technology, nobody would start a website like that. It's like starting Amazon with 5 million books. Amazon started with a handful of books.
It's interesting.
And then they iterated quickly. That's a model that's proven.
And that model, that DNA for that model, you talk about that not just in healthcare, and obviously you were using it at IBM, but you use it in terms of leading any organization.
Any organization.
That is a strong philosophy. And obviously at IBM, it was a big company. You could do that in a little, we often think of that as a little company, iterate fast and change, but you're saying that can happen in every organization.
Yeah, it should happen in every organization. In a small company, it might just be a part-time person. At IBM, I had a group of 54 people that just innovated continuously, and we had air cover and support, and we didn't march to the tune of the budgets, and we were just sort of had a blank check to do things. But
somehow I can't see you marching to the tune of anything, John. I know how your mind is. You're all over the place. Let's talk about attitude, because it's so fascinating to me, attitude in leadership, attitude in innovation, attitude in healthcare, attitude in technology. You run Attitude LLC. Your first book, which I loved, is Net Attitude. Your new book is Health Attitude. You're on my board. I can tell you, everybody, it's always about attitude. How important is attitude to leadership? What have you seen over your career in terms of attitude?
Well, it's simply, attitude is everything. If you have an attitude that you're going to be passionate about something, then you can make things happen. If you have an attitude that's sort of grumpy and negative and focus on what doesn't work as opposed to what could work, then you get nowhere. This is so important in healthcare. The big problems, and the problems in healthcare are big. It's 20% of the economy, so there's a lot of big, important issues and problems. How do we fix it? Attitude. Consumers need to have an attitude to take more responsibility for their health. Physicians need to have an attitude that the patient is really at the center of things and should drive the diagnosis and treatment plans and follow-up and really be right in the middle of it. Hospitals need to get a new attitude that they're not going to be paid every time somebody comes through the doors. They've got to start looking across the continuum of care and realize that, well, we're going to take care of this population, and that's the way we're going to get paid. And we have to get a new attitude that getting paid per head to be healthy as opposed to getting paid per transaction for the sick. That's a big attitude change.
And just to protect it against litigation instead of worried about health.
Exactly.
And you've mentioned that as well in your book. John, I'm thinking about, you talk about so many things that are wrong with the healthcare system, the complexity of the healthcare system, and then attitude. Is there any reason to be optimistic? I mean, when you see the problems, I mean, you outline them pretty clearly, you know, where we are relative to the rest of the world, where we are in terms of using technology, what we're not doing. Is there a reason for a positive attitude for the future of healthcare in America?
I think so. I think the glass is half full, not half empty. The Accountable Care Act, which goes by the name of Obamacare, I don't call it that. Even the president calls it Obamacare. But it has 10 parts to it. We only hear about one part. It's in the news every day, and it has to do with who gets coverage and who doesn't, and how much does it cost, and the website, and all the payer issues. But the other 9 parts have to do with patient safety and quality, which have been falling behind other countries. So this is a really crucial thing to be thinking about. How can we change attitudes to make that better?
Well, you in addition to your new doctorate, in addition to writing this book, one of the things I really liked about this book was the personal stories. I mean, you shared deeply personal stories, first dealing with healthcare with your mom, and then with you personally, and some issues that you were going through right in the midst of writing and doing all these things. And I can attest about John that you're the only person that's ever done this. I asked this question. I said, after you had a surgery, I said, "How are you doing?" And do you remember how you responded to me? You sent me the data to prove that you were walking off of your Fitbit. I thought, who else would do this? That's what you did.
Well,
I tell that story often. I say, we have a board member who actually sent me the data to prove that he was walking. So, but this personal side, how did the personal experience that you had impact your thoughts in terms of writing this book and in terms of thinking about healthcare in the future and innovation?
Well, it confirmed what I knew, which is that the processes are old-fashioned, paperwork everywhere. The system really needs a lot of improvement. So my personal experience as I went through surgery and radiation treatment last summer, it gave me a sense of urgency about this book to get it out there and to have more people become aware of why it is in such trouble, but also to see that there are solutions. There are a lot of good things in the Healthcare Reform Act. Patient safety and quality are getting better. The cost curve is beginning to bend. And so we should be optimistic, and the consumers are going to lead this revolution of change through mHealth, mobile health devices attached to the iPhones and smartphones. This little phone we all carry in our pockets, it's a supercomputer. It's more than 100 times more powerful than Seymour Cray's Cray 1 supercomputer. And what does that mean? That means that you can attach things to it and do your own blood analysis. You can do a 30-second EKG. You can look in a baby's ear and see if they have an infection. You don't have to run to the doctor for every little thing.
Amazing.
Yeah.
38 years, I think you were with IBM. Do you still bleed blue? Can we test that?
Oh, yeah.
Does your iPhone tell us if you're bleeding blue? 38 years with IBM, and you've seen all this change, and you've seen now that we carry these devices. What would be the size? I'm just going to end with this because you're talking about the hope of healthcare, and you have all of this fascinating information in the book. What size computer? What would it take in terms of size to have the computing power that we have in our pockets today?
Oh, well, you couldn't fit it in this building.
It's amazing.
Yeah.
And this is a very large building.
And this is a big building.
That's amazing.
Yeah.
So we actually just, you couldn't even do it probably then.
No, would not be possible.
This is great. Thank you for sharing. It's a great book. I like both of your books though, for a couple of reasons. The healthcare book, not just because you're outlining the complexities and saying, here's what we do about them. This book as well, but underlying both of your books on attitude is just that. And I think it's important for people leading small business, large organization, leading a company, a library, any organization, to realize that attitude really, really matters.
It matters.
It really,
it's everything.
It sets the sail, right?
Right.
And so I've noticed my own kind of orientation of saying, wait, where am I on this? What's my attitude? And if I adjust that, everything changes, even before I even go out. So it's been great. So thank you, John.
Thank you,
Appreciate it.
Skip.